If you wake up at 2 or 3 a.m. to pee, struggle with a weak stream, and feel that nagging urge again minutes later, you are likely facing an enlarged prostate. It is common, it is not your fault, and there are smart, simple steps you can take today. This is about real relief, not magic. It is about a clear plan that respects both modern urology and prostate treatment in Ayurveda. First, a quick truth that calms the mind. An enlarged prostate, also called BPH, is not cancer. It's a benign growth that squeezes the urethra like a hand around a hose. That is why the flow slows, the bladder does not empty fully, and sleep gets broken. Still, stay wise. If you have fever, burning pain, blood in urine, or you cannot pass urine, see a urologist fast. Your health comes first. Why consider Ayurveda here? Because Ayurvedic treatment for enlarged prostate focuses on the root patterns behind the symptoms. In simple words, it aims to calm the body's wiring that controls urine flow, reduce irritation, and help the bladder and prostate work in better rhythm. In Ayurvedic terms, many men show a Vata pattern, irregular flow, frequent trips, often with a touch of Pitta irritation. Balance these, and the body often responds. Think of it like tuning a musical instrument. A small twist in the right place changes the whole sound. Start with habits that give quick wins. Time your fluids. Keep sipping water through the day, but slow down 2 to 3 hours before bed. This alone can cut night peeing for many men. Reduce caffeine after lunch, chai, coffee, energy drinks. Caffeine is like topping the gas pedal on your bladder. It makes everything more urgent. Also look at evening meals. Heavy, very spicy, late dinners push the body to stay active at night. Choose a warm, lighter dinner and give yourself time to digest before sleep. Support digestion to support the prostate. When digestion is smooth, the body holds less fluid and irritates less. A simple Indian favorite helps here. CCFT, cumin, coriander, and fennel. Sip it midday. It's gentle, it's easy to make, and many men feel lighter and less bloated. Add a few minutes of movement. Gentle yoga and short walks help the pelvic area relax. Even basic pelvic floor exercises, the same gentle squeeze you'd use to stop urine midstream, done in sets through the day can improve control over a few weeks. Now let's talk Ayurvedic medicine for enlarged prostate. Some herbs have a long history of use and emerging evidence. Gokshura, called Tribulus in English, is used to support urinary flow. Varuna, or Crataeva, is known for bladder support. Punarnava, Boerhavia diffusa, helps with fluid balance. Pashanabheda, Bergenia, is used traditionally for the urinary tract. Practitioners also use classical formulas like Chandraprabha Vati, Gokshuradi Guggulu, and Varunadi or Punarnavadi Kashayam. Small studies and years of practice suggest they may ease symptoms like urgency and incomplete emptying. They are not cures, but they can be part of a smart plan. Quality matters more than anything. In India, look for Ayush-licensed, GMP-certified brands. Check for third-party heavy metal testing. Avoid products that promise instant results or hide their full ingredient list. If you take medicines for blood pressure, diabetes, or blood thinners, talk to your doctor before adding any supplement. Your safety is the priority. Here's a real-world picture. A 52-year-old office worker I spoke with, let's call him Ravi, was waking 2 to 3 nightly. He cut late caffeine, brought dinner earlier, added a midday CCFT, and started a trusted Ayurvedic blend with Gokshura and Varuna after checking with his doctor. He also did simple pelvic floor work while brushing his teeth and during calls. In 4 weeks, his nights were mostly uninterrupted and his daytime urgency was down. Not a miracle, just a clear plan done daily. This is what Ayurvedic treatment for enlarged prostate can look like when done right. If you're on tamsulosin or finasteride, keep your doctor in the loop. Ayurveda can complement your current plan. Track progress with a simple symptom list.
How many times at night? How strong is the stream? How often do you rush to the toilet? When you see change on paper, you stay motivated. If symptoms get worse or you have red flags, escalate care quickly. Integrated care means you use every smart tool in the right order. Now, if you want a shortcut to get started without guesswork, there is a high-quality encapsulated formula linked in the description. It blends time-tested herbs like Gokshura, Varuna, and Punarnava in doses designed for daily use from an Ayush-licensed, GMP-certified maker with heavy metal testing on every batch. It's made for men dealing with enlarged prostate symptoms who want a simple, consistent routine. Click the link in the description to check it out and see current offers. Stocks for each batch are limited, so if it is available, grab it while it's in. This is not about chasing a magic pill. It's about stacking small wins that add up. Better fluid timing, lighter dinners, a gentle tea, short daily movement, and, if it fits you, a clean, well-made Ayurvedic blend. That's how you turn chaos into control. That's how you go from restless nights to deeper sleep and calmer days. Remember, an enlarged prostate is common and you are not alone. With a clear plan and steady action, the body can respond. If you want a done-for-you start, tap the link in the description, read the full details on the encapsulated product, and decide if it's right for you. Pair it with the simple steps you heard today, stay consistent for a few weeks, and watch your confidence return each day you wake up rested.